What if I told you that one medical decision after age 60 could quietly determine whether you stay independent for the next decade or begin a slow slide into weakness, complications, and months of recovery you never expected? Most seniors believe surgery is always the strongest solution. If something hurts, fix it. If something wears out, replace it. But modern research in geriatric medicine tells a more complicated story. Some surgeries truly restore life, helping you see clearly. Again, walk without pain or protect your heart from dangerous rhythm problems. Yet others, surprisingly, common ones may offer far less benefit than people are led to believe, especially for aging bodies that heal differently than they once did. According to data from leading U.S. medical centers, thousands of older adults undergo procedures every year that may not significantly improve their long-term health, while other surgeries that could dramatically protect independence are sometimes delayed too long. Tonight, we're going to uncover the truth. 3 surgeries many seniors should think twice about, and 3 that could help you stay active, sharp, and independent for years to come. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1, 3 surgeries seniors should think carefully about. 1. Spinal fusion for chronic back pain without nerve damage. It often begins with something many seniors quietly accept as part of aging. A dull ache in the lower back that never fully goes away. Maybe it shows up after a long walk while standing at the kitchen counter or when getting out of bed in the morning. Over time, that discomfort turns into frustration. Pain medications help only a little. Physical therapy feels slow, and eventually a doctor may mention a powerful sounding solution, spinal fusion surgery. For many older adults, the word surgery sounds like a final answer, a way to fix the problem once and for all. But here is a truth that many seniors are never fully told at the beginning. Spinal fusion can be helpful in certain situations. Yet for chronic back pain without clear nerve damage, it is often one of the most serious procedures to consider carefully. Spinal fusion permanently joins 2 or more vertebrae together so they no longer move. In theory, this stabilizes a painful part of the spine. However, the spine is designed to move as a flexible chain. When one segment is locked in place, the neighboring joints must absorb more stress every time you bend, twist, or even stand up from a chair. For adults over 60, this can create a difficult cycle. Recovery from fusion surgery can take many months. During that time, reduced activity may lead to muscle loss around the core and hips, muscles that are essential for balance and stability as we age. Some patients find that the original pain improves, but new stiffness or discomfort appears in nearby parts of the spine. Research published in several major orthopedic journals has shown that many patients with age-related degenerative back pain experience similar long-term results from non-surgical treatments, such as targeted physical therapy, core strengthening, anti-inflammatory care, and posture correction. In other words, the body sometimes responds better to rebuilding support around the spine than permanently locking parts of it together. The deeper concern for seniors isn't just the surgery itself. It's what happens afterward. Months of limited movement can weaken muscles, reduce confidence in walking, and increase fall risk. And for many older adults, maintaining independence is far more important than simply removing a single source of pain. That's why thoughtful doctors often encourage patients to explore every conservative option first before choosing such an irreversible procedure. But spine surgery isn't the only operation older adults may rush into hoping for relief. The next one is far more common. Performed on hundreds of thousands of seniors each year, yet many people are shocked when they learn how little benefit it sometimes provides. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2, surgery number 1. 2, knee arthroscopy for age-related arthritis. For many older adults, knee pain doesn't arrive all at once. It creeps in slowly. At first, it's just a stiffness when getting out of the car or a slight ache when walking down the stairs. Then one day, you realize something unsettling. The activities you once did without thinking, gardening, grocery shopping, even standing in the kitchen now leave, your knee throbbing. When an MRI shows wear and tear, the next suggestion often sounds reassuring. a quick procedure called knee arthroscopy to clean up the joint. On the surface, it sounds simple. Small camera, tiny surgical tools, a few small incisions, and the promise of relief. Many seniors hear the phrase minimally invasive and assume it must be the safest path forward. But for age-related arthritis, this surgery often does far less than people expect. Here's why. Arthritis in the knee is usually not caused by a single loose fragment that can be removed. Instead, it develops gradually over many years as the cartilage that cushions the joint slowly thins. By the time most adults reach their late 60s or 70s, the issue is usually widespread wear throughout the joint, not just one small area that can be cleaned out. When arthroscopy is performed for this kind of degenerative arthritis, surgeons may smooth rough cartilage or remove tiny debris, but these changes don't rebuild the lost cushioning inside the joint. The underlying problem, cartilage loss and inflammation, remains. Many patients feel temporary improvement only to find the pain returning months later. Large clinical studies in the United States have repeatedly shown that for many older adults with knee arthritis, structured physical therapy, strengthening the thigh muscles, improving balance, and managing inflammation can provide results just as good and sometimes better than arthroscopic surgery. Strong quadriceps muscles in particular act like natural shock absorbers for the knee joint. The deeper concern for seniors is recovery and expectation. Even small procedures require healing. Time, reduced activity during recovery can weaken muscles that protect the knee, making the joint feel even more unstable afterward. For someone already worried about mobility or falling, that setback can be frightening. None of this means knee arthroscopy is never appropriate. It can be helpful for specific problems, such as a torn meniscus causing the knee to lock suddenly. But when arthritis is the main cause of pain, surgery may not deliver the lasting relief many people hope for. And surprisingly, the next type of surgery many seniors consider isn't performed to reduce pain at all. It's often chosen for appearance, yet it carries risks that older bodies sometimes struggle to recover from. Surgery number 3. Elective cosmetic surgery without medical need. There's a quiet moment many people experience when they look in the mirror after 60. The person staring back may seem older than the energy they still feel inside. The skin around the eyes droops a little more. Lines deepen across the cheeks, and suddenly advertisements or conversations about cosmetic procedures start to sound tempting. A small lift here, a tightening there, it's often presented as a quick way to look refreshed. But for older adults, elective cosmetic surgery without a medical reason deserves much more careful thought than most people realize. The concern is not about appearance. Wanting to feel confident in your own skin is completely human. The real issue lies in how the aging body responds to surgery and anesthesia. After 60, the body's ability to heal slows down. Skin becomes thinner, blood vessels more fragile, and the immune system doesn't respond as quickly as it once did. What might be a simple outpatient procedure for someone in their 40s can sometimes lead to longer recovery, swelling that lasts weeks, or complications that take months to resolve. Another factor many seniors underestimate is anesthesia. Even short procedures can affect blood pressure, breathing, and heart rhythm. In older adults, anesthesia sometimes leads to temporary confusion or memory problems in the days following surgery, a condition doctors call post-operative cognitive dysfunction. For someone living independently, even a short period of disorientation can be frightening and disruptive. There's also the emotional side that doctors rarely discuss openly. Cosmetic results are never perfectly predictable. A small asymmetry, prolonged swelling, or nerve irritation can leave patients feeling disappointed or anxious. And for seniors who hope the procedure would make them feel younger overnight, that emotional letdown can be surprisingly heavy. None of this means cosmetic surgery should never be done. In certain cases, such as eyelid surgery, to improve vision or reconstructive procedures after medical conditions, surgery can genuinely improve quality of life. But when the goal is purely aesthetic, it's worth asking an honest question. Will this procedure truly enhance my daily life, or am I taking on unnecessary risk for a result that may be subtle? For many older adults, the procedures that matter most are the ones that restore function, helping you see clearly, walk comfortably, breathe easily, and stay independent. And that brings us to the other side of this conversation, because while some surgeries deserve caution, a few procedures can dramatically improve life after 60, sometimes in ways people never expect. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're in here. Now let's keep going with point number 4. Part 2, 3 surgeries that can protect health and independence. Surgery number 3, 1, cataract surgery. The procedure that can quietly give your independence back. Many seniors assume that fading vision is simply part of getting older. They begin turning on brighter lights in the kitchen, holding books farther away, or avoiding driving at night because headlights seem too glaring. At first, it feels like a small inconvenience, but over time, that slow cloudiness in the eyes can begin to steal something far more important than clear sight. It can slowly chip away at independence. One of the most common causes of this change is cataracts. As we age, the natural lens inside the eye gradually becomes cloudy. Instead of light passing clearly to the retina, it scatters, making everything look dim, blurry, or slightly yellow. Many seniors describe it as feeling like they're looking through a foggy window. What makes cataracts particularly concerning for older adults is not just the vision loss itself, but the chain reaction it can trigger. Poor vision increases the risk of falls, especially when walking on uneven sidewalks, climbing stairs, or navigating dim hallways at night. In the United States, falls are one of the leading causes of injury for adults over 65, and vision problems play a major role. Cataract surgery is one of the most effective and safest procedures in modern medicine. During the surgery, the cloudy natural lens is removed and replaced with a clear artificial lens. The procedure typically takes less than 30 minutes and is usually done on an outpatient basis, meaning patients return home the same day. Most seniors notice improvement within days. Colors appear brighter, reading becomes easier, and everyday tasks from driving to recognizing faces across the room suddenly feel effortless again. Studies from the American Academy of Ophthalmology show that cataract surgery not only improves vision in the vast majority of patients, but also significantly reduces fall risk and improves overall quality of life. For many older adults, restoring clear vision does something deeper than simply sharpen eyesight. It restores confidence. The confidence to walk outside, to drive safely, to remain active and engaged with the world. But eyesight isn't the only thing that can quietly take away independence after 60. The next condition affects mobility itself. And when it reaches a certain stage, the right surgery can mean the difference between living actively and slowly losing the ability to move without pain. Surgery number 2, hip replacement that restores mobility and protects independence. One of the quietest ways aging steals independence is through the hips. It rarely happens overnight. At first, it's a slight stiffness when standing up from a chair. Then, climbing stairs becomes slower. Getting out of the car takes a little more effort. Many seniors begin adjusting their routines without realizing it, avoiding long walks, skipping social outings, or sitting more, often because movement has become uncomfortable. This gradual change is often caused by hip osteoarthritis, a condition where the smooth cartilage inside the joint slowly wears away. Without that protective cushion, the bones begin to rub against each other, creating pain, inflammation, and stiffness. Over time, simple daily activities can become exhausting. The deeper concern is what happens next. When hip pain limits movement, people naturally become less active. Muscles around the hips and legs weaken. Balance becomes less stable, and the risk of falling begins to rise for older adults living independently. This cycle can slowly erode confidence and mobility. That is why when arthritis becomes severe and conservative treatments are no longer providing relief, hip replacement surgery can be one of the most life-changing procedures available. During this surgery, the damaged parts of the hip joint are replaced with artificial components designed to move smoothly and reduce pain. What surprises many seniors is how dramatically quality of life can improve afterward. Many patients report being able to walk longer distances, sleep without pain, and return to everyday activities they had quietly given up. Modern surgical techniques and rehabilitation programs in the United States have also made made recovery safer and more predictable than in previous decades. However, timing matters. Waiting until mobility is severely limited can make recovery harder because muscles may already be weakened. Doctors often encourage patients to discuss surgical options once hip pain begins interfering with normal daily activities rather than waiting until walking becomes extremely difficult. For many older adults, hip replacement isn't just about relieving pain. It's about reclaiming movement, confidence, and the ability to stay active in the years ahead. But there is another procedure far, far smaller and less visible that can quietly protect one of the most important systems in your body, the rhythm of your heart. And understanding when that surgery becomes necessary could save a life. Surgery number 3, pacemaker implantation for dangerous heart rhythm disorders. Some of the most serious health problems after 60 don't cause sharp pain or obvious warning signs. Instead, they appear quietly in everyday moments. You might feel unusually tired while walking across the house. Perhaps you become light-aided when standing up, or you experience brief dizzy spells that pass within seconds. Many older adults dismiss these symptoms as simple aging, but in some cases they may be signals that the heart's electrical system is no longer keeping a steady rhythm. The heart is controlled by tiny electrical impulses that tell it when to beat. Over time, this system can weaken or become irregular, especially in older adults. One common condition is called bradycardia, where the heart beats too slowly to pump enough oxygen-rich blood to the brain and body. When this happens, people may experience fatigue, confusion, fainting episodes, or sudden loss of balance. This is where a pacemaker can become life-changing. A pacemaker is a small medical device implanted just under the skin near the collarbone. Thin wires connect the device to the heart, allowing it to monitor each heartbeat. If the heart slows down too much or pauses unexpectedly, the pacemaker gently sends an electrical signal that restores a safe rhythm. The procedure itself is usually far less invasive than many people expect. It typically takes a few hours and is often performed with local anesthesia and mild sedation rather than full general anesthesia. Most patients go home within a day or two. After recovery, the device quietly works in the background, helping the heart maintain a consistent and healthy pace. For seniors, the benefits can be profound. Many people notice improved energy levels, clearer thinking, and greater stability when walking. Preventing sudden fainting spells also reduces the risk of dangerous falls, which are a major cause of injury among older adults. Equally important is peace of mind. Knowing that the heart's rhythm is being supported allows many seniors to remain active and confident in their daily routines. Simple activities like walking, outside, shopping, or spending time with family feel safer again. But understanding which surgeries truly protect health and which ones may cause unnecessary risk is only part of the picture, because when it comes to medical decisions after 60, the most important lesson isn't just about procedures. It's about learning how to choose wisely for the years of life still ahead. The wisdom of choosing the right care. After 60, growing older changes the way the body responds to medical treatment. Procedures that may have been simple in our 40s or 50s can carry very different consequences after 60. Healing slows down, muscles weaken faster during recovery, and even a hospital stay can temporarily affect balance, memory, and independence. That is why the decisions surrounding surgery become far more meaningful in the later chapters of life. The deeper lesson from everything we've discussed is not that surgery is good or bad. It's that the right surgery at the right time for the right reason can protect health, while the wrong procedure may add stress without truly improving daily life. For many seniors, the greatest goal is not simply living longer. It is maintaining the freedom to walk, see clearly, think clearly, and take care of oneself without constant medical intervention. Some procedures deserve careful hesitation because their benefits may not outweigh the risks for an aging body. Others, such as restoring vision, replacing a severely damaged joint, or stabilizing a dangerous heart rhythm, can dramatically improve quality of life and help protect independence for years to come. What matters most is understanding your body and asking thoughtful questions before making major medical decisions. A good conversation with your doctor should always explore alternatives, expected recovery time, and how the procedure will truly affect everyday living, not just test results or imaging scans. Looking ahead over the next 1 to 5 years, The choices you make about your health can shape how active and independent you remain. Protecting mobility, preserving clear vision, and supporting heart health are three of the most powerful ways seniors can maintain strength and confidence as they age. Aging may make the body more fragile, but knowledge creates protection. When you understand which treatments truly support your well-being, you gain the ability to guide your health rather than simply react to it. And sometimes the wisest medical decision isn't the most aggressive one. It's the one that helps you keep living life on your own terms. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.